Welcome back to Mindful Objective, the show where we explore health through an integrative and practical lens. I'm your host, Dr. Daniel Sproul, integrative health practitioner and professor. Today we're talking about metabolic syndrome. This is a cluster of issues that quietly build for years before symptoms become obvious. It affects blood sugar, blood pressure, cholesterol, inflammation, and how your body stores fat. What makes metabolic syndrome so important is that it often develops long before someone is diagnosed with diabetes or even heart disease. It can influence energy, appetite, sleep, stress response, and even how your brain functions. Metabolic syndrome forms when the body struggles to manage blood sugar and inflammation. When this happens, the cells stop responding well to insulin and fat cells. They begin releasing inflammatory signals. This combination starts affecting your entire system. The good news is that metabolic syndrome is something you can influence through nutrition, movement, stress support, sleep improvements, and with targeted supplementation. In this episode, we'll look at what metabolic syndrome is, how it develops, the early signs that people often ignore, the functional labs that provide a deeper insight, and the integrative steps you could take to support healing naturally. As always, this show's for educational purposes only. We do not diagnose, treat, or cure any illness or disease. So now let's go ahead and dive in. When people hear the phrase, another part that people really consider is the role of inflammation. Fat tissue is not just a place for the body to store energy, it's active. It talks to other cells and releases its own chemical signals. When someone has more fat around the stomach area, the tissue produces more inflammatory chemicals. That inflammation then travels through the bloodstream, affecting how well the body handles sugar, how blood vessels expand and contract, and how well cells take in nutrients. This is why metabolic syndrome is strongly tied to heart health and blood sugar control. Something else that surprises many people is that metabolic syndrome can affect anyone, even people that look thin on outside. Some might wear a smaller clothing size and still have insulin resistance, high triglycerides, or low muscle mass. This is sometimes called skinny fat. It means that persons with low muscle tone but higher internal fat around those organs. From the outside, everything looks fine. On the inside, the risk is still very real. All this can sound overwhelming, but the purpose of understanding metabolic syndrome is not to scare anyone. It's to help people see that there's something they could do to influence and get to that right approach. It is something that shows up long before major illnesses develop, which gives us time to work on it. Once people see that full picture, things start to make more sense. The fatigue after meals, the stubborn weight gain around the stomach, the cravings, afternoon crashes, the difficulty sleeping, and changes in mood are often connected to that same root problem. Metabolic syndrome is not about blame and shame. It's not about willpower. It's not about personal failure. It's a signal that our body needs support. That support comes from food choices, movement, sleep, supplements, stress care, and understanding your unique physiology, which works. One of the most empowering things about metabolic syndrome is that small changes really do help. You do not need to be perfect, right? We always preach on that. You don't have to be perfect in any of this. You don't need strict dieting. You need a few consistent habits that calm inflammation and help the body regulate blood sugar again. Understanding what metabolic syndrome is sets stage for how it develops. And once you see how it develops, the next steps become easier to understand, even how to put in the right action. Let us walk into the next piece of that together here. So now that you have a clearer picture of what metabolic syndrome is, it helps to understand how it actually develops. Most people imagine it comes from overeating or not enough exercise. While those all play an important role, the real story is far more layered here. It develops slowly through repeated patterns that feel normal. It builds through small daily habits, long-term stress, poor sleep, and nutrient gaps that go unnoticed for years. When you understand how each of these pieces fit together, you begin to see why metabolic syndrome is so common today. One of the biggest drivers is insulin resistance, right? Insulin is a hormone that helps move glucose from the bloodstream into those energy cells. When the body becomes less responsive to insulin, glucose stays in the blood longer. This forces the pancreas to produce more insulin to get the same job done. Over time, insulin levels stay high. High insulin makes it harder to burn fat and easier to store it, especially around the stomach. Many people feel frustrated because they think they're doing everything right but still cannot lose weight. In many cases, it's not a lack of effort. It's that their insulin has been elevated for years. Another major piece is that inflammation. When inflammation rises, insulin resistance gets worse. When insulin resistance gets worse, inflammation increases. It becomes a cycle. The inflammation may come from poor diet, lack of sleep, food sensitivities, gut issues, toxin exposures, or even chronic stress. These do not have to feel dramatic to be meaningful, right? Even small levels of inflammation over time can push the body towards that metabolic imbalance. Sleep here also plays a big role, more than people ever think. Even one night of poor sleep can reduce insulin sensitivity the next day. Think of that over months, right? Months and months to years. It damages the body. Poor sleep increases cravings for carbohydrates, which leads to blood sugar spikes and crashes throughout the day. People often think that they have a discipline problem, right? They can't control themselves, but in reality, the body is asking for fast energy because sleep was not restorative. Stress affects metabolism more than people realize also. When cortisol, which is the main stress hormone, stays high for extended periods, it raises the blood sugar and increases your appetite. It also encourages the body to store more fat in that midsection. Someone may not feel outwardly stressed, but their body might still be living in that stress state even if they're overwhelmed, overworked, or carrying emotional strain for those long periods of time. Gut health is another factor. The gut interacts with hormones, inflammation, and even your appetite. When the gut lining becomes irritated or when that balance of bacteria shifts, the body becomes more inflamed. That inflammation impacts blood sugar and cholesterol. Many people with metabolic symptoms do not have digestive complaints at all, but their gut still is part of the big puzzle here. Another one is environmental toxins. These also influence that metabolic health. Certain chemicals found in plastics, pesticides, and personal care products can disrupt your hormones. These chemicals interfere with hunger, fat storage, blood sugar control, thyroid function. When the liver is overwhelmed trying to process these toxins, your body becomes more inflamed and less metabolically flexible. So nutrient deficiencies are another one we talk about a lot, and those are often overlooked. Low magnesium, low vitamin D, low B vitamins, and low omega-3 levels all impact blood sugar regulation and inflammation. Most people have at least one of these deficiencies without even knowing it. A lot of times because they never check, right? All of these factors build, the body slowly shifts towards metabolic syndrome. It usually starts silently with small changes in energy, sleep, cravings, or even your digestion. Eventually, blood pressure rises, triglycerides increase, glucose rises, visceral fat builds. Although the process can sound discouraging, it is actually a powerful opportunity we have here. Once you understand how metabolic syndrome develops, you can see how to unwind it. Every part of that process can be supported, and small improvements in one area often lead to improvements in other areas. Now that you know how your body gets to this situation, next step is recognizing those early signs that go unnoticed. This is where things start to become clear for people. So, what are we going to do? We need to recognize those early warning signs of metabolic syndrome. This is one of the most powerful and helpful things you could do for your long-term health. The challenge is that you got to understand these signs early and notice their everyday problems. People assume they're normal parts of aging, busy schedules, stressful weeks. Because of that, metabolic syndrome can progress quietly for years before someone realizes what's actually happening to them. When you understand the small clues the body gives, you can step in much earlier and get ahead of that bigger issue. One very common symptom is fatigue after meals. This is probably everybody, right? Many people shrug it off and think they just ate too much. In reality, it's often a sign that blood sugar spike and then drop quickly. When blood sugar rises quickly, insulin comes rushing right back down. If it drops too fast, energy falls within it. This is why people feel that tired and foggy after lunch. It's one of the early warning signs of that metabolic imbalance. Cravings is another big clue. When cravings, especially for sweets or carbs, become a daily pattern, it usually means that the body's struggling to maintain stable glucose. The brain depends on stable glucose. If glucose is constantly rising and falling, the brain sends out signal asking for quick fuel. People often think this is a sweet tooth, but the craving has much more to do with physiology than a preference. Sleep changes are also more common, right? Trouble falling asleep, waking up in the middle of the night, waking up tired despite enough sleep all connect to blood sugar instability and that cortisol imbalance. Some people wake up around 2 or 3 in the morning because their blood sugar dropped and cortisol rose to compensate that time frame. Most people never make this connection here. Another overlooked sign is frequent thirst or more frequent urination. This happens when glucose is elevated, even slightly. The body tries to clear extra glucose through the kidneys, which makes some people go to the bathroom more often than others. This leads to increase in thirst. Many people assume they're just dehydrated, but the real issue often is that blood sugar. Right? Brain fog is another early sign. When inflammation rises or the brain does not receive steady fuel, focus does become harder. People might feel forgetful or mentally slower during parts of the day. This is strongly tied to that metabolic health. Mood changes can also be part of this picture. irritability, anxiety, low motivation can all be signs of blood sugar swings. When glucose rises and falls quickly, the brain feels unstable. People often think this is just stress, but it may be that metabolic strain. Weight gain around the stomach is another visible sign. This is visceral fat, right? This surrounds the organs and produces that inflammatory chemicals. Many people assume it's just simply age-related weight gain, but often it reflects deeper metabolic issues. Skin changes are another clue. Darkened patches around the neck or armpits, skin tags, or small bumps around the neck can be linked to insulin resistance. These signs appear long before someone receives that diagnosis. Even elevated blood pressure can be an early sign of metabolic issues. Many people think high blood pressure only has to do with salt or genetics, but it plays a major role in inflammation in the body. When blood vessels become inflamed, they become stiffer, which raises blood pressure. When you start seeing these symptoms together, even the small, simple ones, they paint a clear picture. The good news is catching these early signs give you a real chance to turn things around. And one of the most reliable ways to understand what's happening under the surface is through functional lab testing. And that's where we're heading next. Understanding metabolic syndrome becomes much easier when you see what's happening inside the body. Functional lab testing gives you that detailed view of how the body's handling blood sugar, inflammation, energy productions, hormones, digestion, and your detox pathways. Traditional labs, through your medical doctor, focus on diagnosing diseases, while functional labs, what we do on the health coaching side, is for understanding how well your body's functioning. Both are useful, but functional labs help you see what's happening before problems become advanced problems. A good starting point is fasting glucose and fasting insulin. Most people only get glucose checked, which is helpful, but insulin is often more revealing. Someone can have normal glucose, but very high insulin. This is an early sign of insulin resistance and that metabolic strain. When insulin is elevated for years, the body struggles to burn fat and stays in that state of low energy and the state of inflammation. Another good test is hemoglobin A1C. A lot of people say, A1C. It's another helpful marker because it shows average glucose over a period of 3 months. It gives you a sense of long-term patterns rather than those daily swings. However, A1C does not catch early metabolic changes, which is why insulin testing is so important. A complete lipid panel provides a look at those triglycerides, HDL, LDL, and cholesterol ratios. High triglycerides and low HDL are classic signs of metabolic syndrome. But functional testing can go further by looking at LDL particle size. Right? Smaller, denser particles are more inflammatory and more likely to contribute to that plaque buildup. This gives a clearer picture of cardiovascular risks. So inflammation markers also, such as high sensitivity C-reactive protein, and another one would be homocysteine. These help you understand how inflamed the body is. Elevated homocysteine can affect blood vessels, brain health, methylation. High CRP, which is that C-reactive protein, indicates inflammation in the body, which often connects to insulin resistance and visceral fat. Another important group of tests involves hormones. Cortisol plays a major role in metabolic health. If it's too high or too low at the wrong times, blood sugar, appetite, and energy is affected. A full thyroid panel is also essential. Thyroid hormones influence metabolism, cholesterol, digestion, and temperature regulation. Many people with metabolic symptoms have thyroid imbalances that were never checked because only TSH was measured. Gut testing adds another layer to this picture. The ST1 lab provides details about digestion, bacteria balance, inflammation, gut immune function, and potential infections. An imbalanced gut can increase inflammation and directly affect blood sugar. Even if someone has no digestive symptoms, the gut may still be contributing to that metabolic strain. The organic acid test, which we talk about a lot, this offers insight to mitochondrial function, nutrient deficiencies, yeast overgrowth, neurotransmitters, and your detox pathways. Since energy production is tied to metabolism, this helps us identify why someone may feel tired even when they eat well. Then we have another test here, the heavy metals test, right? This can identify heavy metals and toxins from the environment. These toxins act as hormone disruptors. They affect appetite, blood sugar, thyroid health, and even your fat storage. Removing toxins can help the body become more responsive to nutrition and daily activities. So functional lab testing helps us personalize that care. Instead of guessing, you know exactly which areas need support. This makes healing process faster and more effective. And once you know what's happening inside the body, natural strategies become clearer. That takes us into this final phase here. When it comes to healing metabolic syndrome, the most important thing to know is that the body responds very well to steady and supportive changes. You do not need extreme dieting. You do not need to overhaul your life in 1 week. You need a combination of small habits that calm inflammation, that balance your blood sugar, that support your hormones and help your body energy work more efficiently. When you improve these areas, the entire body becomes more resilient. So nutrition is another one of the most direct ways to support healing. The goal is to create meals that help keep blood sugar steady. This means including protein in each meal, adding healthy fats, and making sure there's enough fiber from vegetables, beans, fruit, and even whole foods. Protein helps slow the rise of blood sugar. Healthy fats provide lasting energy and support your hormones. Fiber slows down digestion and prevents those sharp glucose spikes. Many people notice improvements just by reducing added sugars and processed foods and building meals from whole, simple ingredients. Remember, eat whole foods. Movement plays another major role. Strength training is one of the most powerful habits for metabolic health. Muscle helps the body use that glucose better, which improves insulin sensitivity. You do not need heavy lifting. Simple routines with resistance bands or body weight exercises make a difference. Especially walking after meals. It's incredibly helpful. Even a 10-minute walk can lower blood sugar and improve digestion. Sleep is another pillar in metabolic healing. When sleep improves, your hunger hormones balance out. Cravings decrease. Cortisol becomes steadier. You wake feeling more refreshed and more control of your day. Simple habits like reducing screen time before bed, keeping a consistent sleep schedule, and creating calming nighttime routine can lead to meaningful improvements. We say, got to deal with your stress, right? When stress remains high, cortisol pushes the blood sugar up and keeps the body in that storage mode. Gentle practices like deep breathing, stretching, prayer, journaling, yoga, spending time outside, these all help lower stress signals. You do not need a perfect mindfulness routine. You only need small pockets of calm built into your daily life. Take one day at a time, one thing at a time. Relax, breathe. Life goes on. Tomorrow's another day. So supplements, they can support metabolic health, especially when chosen based on lab results. Omega-3s, perfect for helping reduce inflammation. Magnesium supports glucose control and muscle relaxation. Vitamin D helps regulate hormones and immune health. Berberine can help improve insulin sensitivity and support your cholesterol. Chromium helps reduce cravings. Adaptogens like ashwagandha help rebalance cortisol. Don't forget, our full script offers all these supplements at 20% below retail, which is more affordable than Amazon, and every product is practitioner trusted. Remember, third-party tested, you want quality products. So visit the website, mindfulobjective.com. Feel free to sign up. Enjoy our 20% off. Detox support helps lighten the body's overall load. Drinking filtered water, supporting the liver through foods and leafy greens, cruciferous vegetables, broccoli, cauliflower, sweating through exercise or sauna use, and reducing exposures to plastic. These all can help. Some people benefit from targeted products like a universal binder or a heavy metal detox when your testing shows you have toxins that are contributing to your problem. So gut support is another important piece, right? Probiotics, prebiotics, digestive enzymes, and gut healing nutrients can help reduce inflammation and improve that nutrient absorption. When the gut functions well, metabolic health improves gradually and naturally. So the biggest lesson is healing our metabolic syndrome. It's not about perfection. It's like we do with everything here in integrative health, consistency. When you do a little bit in each area, the body responds. Energy rises, cravings settle, sleep improves, weight becomes easier to manage, and you feel more like yourself again. So as we wrap up this episode, remember that metabolic syndrome is not a single condition. It's a pattern that tells the body that it's under strain for a long, long time. When you understand what drives it, you can take clear and targeted steps that support your heart, your blood sugar, your hormones, and that long-term health. So if you never looked at markers like fasting insulin, triglycerides, your cholesterol, maybe even your waist circumference, right? It may be time to review all these things. You can also reach out through our practice if you want help with functional lab testing or even conventional lab testing that explores blood sugar regulation, inflammation, gut health, mitochondria function, hormone balance, and even supplement recommendations. So thank you for listening to Mindful Objective. The best healthcare is proactive and integrative. Keep learning, take consistent steps forward for better health, and stay curious about what your body's trying to tell you. As always, remember this information shared here is for educational purposes only, should never be taken as medical advice. Always consult with a qualified healthcare provider before making any changes to your health plan. See you next time. Stay well.